Hello, this is Anjul Goyal from Wayhead, Delhi. I am having the pleasure of being in the campus of Donetsk National Medical University, Kirovograd, Ukraine. I'm right now in the august presence of Dr. Katerina, who is a professor of anatomy in the Donetsk National Medical University. Good morning, Dr. Katerina.
Good morning everybody.
Okay, so my query to you, Dr. Katerina, would be, can you please elaborate on the subject which you teach and which is the medium of instruction of that subject?
We have to teach our medical students for anatomy. I assume this is a language of medicine. So with no knowledge of anatomy, nobody can communicate with the disease, with the diagnosis, with the symptoms. So that's why the teaching of anatomy is one of the priorities on the first year students. So our anatomy course consists of several modules. One of them is locomotor system. It contains osteology, arthrosyndesmology, myology. Then it is splanchnology, and we study digestive system, respiratory, urinary, reproductive, and endocrine systems. And then two big modules about central nervous system and heart and peripheria, meaning circulatory and nervous peripheral systems. So these four modules are divided by two big parts. First part is for first year, the second part is for second year. Both of the parts are finishing with the final exam, so our students get in score for first and for the second part.
Okay. As an outsider, I'm curious to know what is the quality of education at Donetsk National Medical University, and more specifically vis-a-vis your subject?
The quality of education will be scored literally by passing of the crock. We will have a very big exam which will contain 200 questions of 1,000, which will include the questions which will be made like clinically oriented questions, including physiology, pathomorphology, anatomy, and chemistry and biology and pharmacology. So all the subclinical subjects will be formed in this CROC 1. It is like step 1 in USMLE. Right here in university, it is the level of how did we taught our students, how they learned all the subclinical subjects. So they pass this exam after the third year, and after the fourth, fifth, and sixth year, they have CROC 2, which will include the questions in clinical subjects, which the medical students will pass. So it will be the level which will show how students actually learned what we taught them. It will be the result of our quality of our education. What we doing? We are doing our best to give the knowledge according to the English textbooks which are used in English-speaking countries. Actually, anatomy, we are learning anatomy by Henry Gray, by Kenneth Saladin. So there are textbooks which are in use in medical universities of the United States of America, the United Kingdom. So we are trying to do our best to give the best knowledge of anatomy, the same in other subjects.
Okay. Dr. Katerina, for the Indian students who are coming so far away and studying in Donetsk National Medical University, what is your interpretation of the quality of Indian students, and how good are they able to cope up with the education here in the university?
Actually, all the Indian students are very highly motivated children. What is really their level, it is very high motivation for learn. So they came really to study medicine. And actually they show very high quality performance. So they really show a good level of pre-university level of biology and anatomy. Sometimes they finished private schools, and the biology level in their performance is actually came from very high performance from school. So they had very good level of the biological studies back in school. So background is very strong. Some children are not so strong, but anyway, what is really the main feature of all Indian students is very high motivate.
Okay, so in your opinion, they are able to comfortably, by virtue of their motivation, cope up with the rigors of the academic curriculum at the university?
Yes.
Okay, fine, fine. Thank you very much, Dr. Katrina, for your time.
You're welcome.